Good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. Joining us today are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, and Lubbock Mayor, Dan Pope. Let's start with Catherine Wells.
Thank you, Lacey. Good morning, everybody. It's great to be here again. Just kind of want to update you on some of our case numbers and then also talk about some updates we're now seeing from both the CDC and some changes to our eligibility guidance for vaccinations. Our case counts continue to look really good. We actually had a day of less than 10 cases, which is fantastic. However, we still want to make sure everybody stays the course, continues to wear their masks. We're not out of this yet. Really saw some good news from CDC. Some much awaited guidance was released this week for fully vaccinated individuals. The key parts of this guidance are that fully vaccinated individuals can now visit with other fully vaccinated individuals indoors without a mask. This is the first time in a long time that we've seen CDC making a recommendation or encouraging some visitation. There's also some good news for all of our grandparents out there that we hope are now vaccinated, that they can visit with individuals who are unvaccinated, as long as those individuals are low risk. We still want to limit these visitations to 2 households. We don't want to have large gatherings. We still want to keep crowd sizes small, but it does allow those grandparents who are vaccinated to visit with those families. For fully vaccinated people, it's still important that they wear a well-fitting mask and practice physical distancing while out in public. It's also important that they take precautions when visiting with large groups of unvaccinated individuals. And then you want to avoid medium and large size gatherings. We still want to keep those gatherings small. The other good news we had last week was that the state of Texas expanded its eligibility for vaccinations to our teachers. They're defining teachers as our K-12 teachers, and then also looking at any daycare workers. So teachers in that K-12, daycare workers, employees of our independent school districts are all eligible for vaccine, and we encourage all of them to come down to the Civic Center or work with your physician to get that important vaccine. Over the last 2 weeks, we've really started to see a drop in our first dose appointments for our eligible groups. If you qualify, we encourage you to make an appointment. The Civic Center clinic is set up for our entire community, and that's not just Lubbock residents. We want to see individuals from our surrounding counties also come in to access vaccine. The state is closely watching our uptake on vaccine, so it's really important that we're filling up those first dose appointments to show that we need this vaccine here in the South Plains and it doesn't go other places. The health department also now has a little bit of Pfizer vaccine. So if you are a parent of a 16 or 17-year-old who hasn't been able to get the vaccine that does meet those qualifications, so say a young person with diabetes, please call the health department to make an appointment. We are not going to offer Pfizer at the Civic Center. However, we will make individual appointments at the health department. We also have some resources now to go out and vaccinate people in their homes. So if you are homebound, please call the health department and we will work to get you scheduled. That health department number is 775-2933. With that, I will pass it over to Dr. Cook.
Thank you, Catherine. Let me say thank you to Catherine and all the work that you've done down at the Civic Center to get something like 66,000 patients or 66,000 doses of vaccine into our citizens. Thank you to the good citizens of Lubbock for doing your part in slowing down this virus. And thank you to all the volunteers, both our citizens of Lubbock that are volunteering and our city staff that have been down there volunteering and working to get 66,000 doses of vaccine into our community. That's what has, I believe, what helps slow down our number of cases. We're not out of the woods yet. We still have lots of people to vaccinate. Our hospital numbers are significantly improved, very low numbers of COVID patients in our hospitals. However, the hospitals are doing their business. We're a regional acceptance center. We're the largest acceptance center between Albuquerque and Dallas. And so our hospitals here are very, very busy. In fact, so busy last night, we still had 13 patients that needed beds. So let's don't put COVID patients. Do your best to make sure that you don't get COVID. In the last 7 days, our total positive cases average about 11.7 positive cases per day. That's a significantly low number from where we were. But please don't let your guard down. This virus is still out there. It is still causing death and significant illness and long-term illnesses. Let's continue to do our part in wearing our mask and socially distancing and washing our hands. And please make sure that you get your second dose. If you're in this 1A, 1B category, please come get your dose. That's available to you. We still have lots of people in that group that need to be vaccinated. As Catherine said, the state opened up and said that K through 12 teachers can get that vaccine. Please come in and get your vaccine if you're eligible. I believe, or word on the street is that maybe the state will open up to 1C category, maybe around the 1st of April. We don't know yet, but that's our best guess. Lubbock has all 3 vaccines in town. We have Pfizer and Moderna, and now we have the Johnson & Johnson vaccine. It's here, it's the 1-dose vaccine. It's about 70 or 67% effective at preventing disease, severe and very effective at preventing severe disease. In fact, nobody that received the vaccine was hospitalized. Even at 67%, that means 33% have the possibility of getting the disease, but nobody was sick enough to be hospitalized. That's fantastic news. And that's a 1-dose vaccine. The other 2 vaccines are still 2 doses to get the best level of immunity. So vaccines don't prevent disease. It's vaccinations that prevent disease. So that means it's got to be in your arm to prevent the disease. So again, get it when it's available to you. Let me just talk a little bit also about the CDC guidelines. Those guidelines are for those individuals that have been vaccinated. Nothing has changed for you if you have not received a vaccine. So if you've been vaccinated, you can meet with other people that are vaccinated, or you can meet with unvaccinated people living in the same household. But those things, if you have not received the vaccines, nothing has changed. You still need to wear your mask and socially distance and wash your hands. If you turn positive with the virus, remember that we still have the antibody infusions available for you if you're high risk, and that's in an effort to keep you out of the hospital. Those infusions are happening over at Grace Hospital on 50th and University. Let's talk a little bit about spring break. I mentioned this 2 weeks ago. Spring break is on us for next week. Please be safe. Just please be safe. Make sure that you're socially distanced, you're wearing your face masks, and if at all possible, be outside. That's why we go on spring break, is really to be outside. And so that's better than being inside. I would still avoid the East Coast or the West Coast. Those are still hot spots. And that's where they also have those mutations that we worry about. Lastly, thank you for everybody that you've done a good job. Our COVID numbers are significantly improved. If you're not vaccinated, we still need to wear a mask. We still need to be socially distanced, and we still need to wash our hands. Thank you. Let me hand this over to Mayor Pope. It's all yours, sir.
Good morning. Thank you, Dr. Cook. Thank you, Ms. Wells. Great job. You guys continue to just I'm so proud of you. This whole community is, and thanks for what you do for all of us. Let's start this morning with just a little data update. I think you guys will find this interesting. It's sort of our practice, so bear with me for a moment. Okay, so hospitalization rate, Dr. Cook alluded to this a minute ago. You can see how well we're doing here, below 5%, and so that's just a one indicator, but it's maybe it and the positivity rate are among the most important indicators. Our positivity rate is also below 5%. So here's just a depiction of that. This probably is the slide that I most want to spend or draw most attention to. You know, the new cases by age group are still concentrated in our 18 to 25 year olds, and we've seen in respect to the other cases, this one has not come down as much, or it's spiked up, which you already want to look at it. So it's an area that we still need to work on, and this part of our population often carries the virus without knowing they have it. So we'll continue to watch this, but we thought you might find this interesting. Hospital beds, Dr. Cook alluded to this. There's no red flag here. The hospitals are busy. They're not busy with COVID. In fact, they have about 10% of the COVID cases today that they had on January 1st. And finally, just a chart that shows our vaccinations, the blue being the first, blue part of the bar being the first dose, and the orange part of the bar being the second dose. And I'm thankful for the efforts there, as Dr. Cook talked about. So let's talk a little bit more about vaccinations. We've vaccinated, according to the state numbers, as through last week, we've vaccinated more than 41% of our eligible population, the ones that are eligible to be vaccinated. And that includes adding over 9,000 new, our denominator got bigger because we added those folks that Ms. Wells talked about that are now eligible for the vaccine. So still doing a very good job. It looks like Fort Bend County has nudged us out of first place. We're asking for a recount, but we still, Lubbock and Fort Bend County and the folks up in Amarillo are leading the way for the state. And we want to keep putting this vaccine in the arms of Lubbock citizens. That's the goal. To help that, we learned yesterday that 2 of the Walmart locations in Lubbock will be getting vaccines through the federal program. The Walmart on the West Loop and the Walmart on the South Loop will be receiving those, and pay attention for details on that. I don't have any further details. If you need to get a vaccine or you have your appointment and you don't have a way to get there, we've got a way for you to get there, and it's free. Download the City Bus on demand app. It's available in the App Store or the Apple Store, or the other side of the fence. I went blank on that one for now. I'll remember that in a minute. Or you can call 775-3640. We'll get you a ride set up. It'll be in one of our smaller vans, and it's free. Did I say it's free? We want to make sure there are no barriers to you getting vaccinated. Okay. All right. Let's talk about the reopened Texas. Today is by the governor's order, when GA 34 takes effect, his new order, and the mask requirement is now relaxed. Now in Lubbock last week, when he made this announcement, he talked about reopening Texas, and really in the very same breath, he said, but it is important that we continue to be vigilant and stay safe. We know what keeps us safe. These are individual decisions. We don't need the government telling us this. And I'm so pleased that our businesses and large institutions, the Texas Tech, South Plains College, United, HEB, many of our small businesses, the city facilities we've kept in place, these folks have all kept in place their protocols around face coverings. It's important for us that we protect our employees. It's also important that we protect our customers. And I think you'll see that for the next few weeks as we're able to vaccinate more people. But please be respectful of that. Remember that you're not only protecting yourself, it's the people you love, and it's our neighbors. Our ALERT task force, which has been the Lubbock Economic Recovery Task Force, will be meeting tomorrow. They may have to change their name to the Lubbock Economic Reopening Task Force, but they will be coming out with some best practices, working with the business community, working with our all of our community, the faith community, our education community, and trying just to continue to lead the way with this effort. So pay attention for communication from them in the very, very near future. Okay, as I wrap up, a reminder. We will just be doing these press conferences every other Wednesday. So prepare to hear from us again on the 24th. Public health reporting related to the pandemic will change effective this Friday, the 12th. Starting next Monday, starting Friday, we will only be reporting on weekdays. The Monday report, however, will include both details on Monday as well as Saturday and Sunday. I'm thankful for your work to safely reopen our community, to save lives and livelihoods. I appreciate your thoughts and hope words. We need to remain hopeful. We need to stay the course. Much better days are in our very, very near future. It's a great day in Lubbock, Texas. Lacey, back to you.
Thank you, Mayor. All of our panelists will turn their cameras back on. We will now open it up for media questions. And today's media question order is Latino Lubbock, the Avalanche Journal, El Editor, the Daily Toreador, KMAC, KCBD, and Texas Tech Public Media. So let's get started with Christy Martinez Garcia with Latino Lubbock.
Good morning, everybody. Mayor, I can't help to notice how you guys continue to make this almost a competition of what city gets the vaccines the fastest. And I can tell you that while we've been first, I bet you I have more deaths in my family to COVID in the last 4 months than you do. We'll be burying my sister-in-law on tomorrow. So I have 7. I bet you can't say that. So it seems like a joke, and I understand you're trying to be funny, but it isn't. So that said,
let me respond to that. It's not a joke. It's very important that we get vaccines in people's arms, and there's nothing joking about it. I spend an inordinate amount of my time trying to make sure that we have ample supply and we're getting our share. And my deepest sympathies to you and your family, Christy.
I appreciate that, but just keep that in mind because it is still a sensitive topic for a lot of families. That being said, let me go ahead and ask my questions. Dr. Cook and Catherine, do you believe that the mask this mandate being lifted was premature, or are you confident that the public can be responsible enough to wear those masks?
Christy, that's a great question. I don't think the good citizens of our community need to be told what to do to be safe. I think that was clearly evident even after the governor was here. I went to the grocery store and I saw lots of people wearing masks. I saw very few. I really saw no difference in that effect, even though it doesn't go into effect till today. I have complete confidence in our community to do the right thing, to care about other people, and to care about themselves and not spread the virus. We can't blame our low numbers just on vaccines. I think it's also good. People's actions are showing that they care about others by continuing to wear masks where appropriate. if you're in your own office by yourself, you don't need to wear a mask. If you're outside running, I don't think you need to wear a mask. But if you're in a group, you need to wear a mask. And I think people will continue to do that. Even respectfully, even if you're vaccinated, we don't have any kind of little sign or some people have a phone app that says I'm vaccinated. We don't have that. And so I think people will do the right thing to show that whether or not they're vaccinated or not, they're going to wear a mask until we have this disease stomped down.
Okay, wonderful. So my next question, I know that we're now letting or teachers and childcare folks are now starting to get the vaccine, but we're still seeing the highest number of cases in the 18 to 25. Doesn't it make sense to consider getting this age category vaccinated? Because, it's still the highest group, and with spring break, I know that a lot of students, even though those dates have been modified, are going away. I have 3 students that work for me that will be leaving soon to go and take care of that. So doesn't it make sense to do this particular age group, to add them soon, or figure out a way to get them vaccinated?
Christy, I think, yeah, it makes sense. But we also need to protect those that will be, in this whole vaccination plan, the goal here was to prevent our hospitals from being overwhelmed. And so, yes, those people are asymptomatic carriers or mildly symptomatic, but they can spread it. Our first goal is to get especially those high risk individuals that are going to get sick enough to go to the hospital and overwhelm our hospital system. We've been there already. We don't want to go back there. I agree. It's right now, it's a matter of who the first priority is and trying to get those people so we don't overwhelm the system. But we're mandated to either follow the CDC's guidelines or what the state Department of Health mandates that we vaccinate next. I agree that I wish we had vaccine for everybody today. We just don't.
Yes, I have to ask this, Catherine, because I've got a church that they want to have vaccinations done there. Is there any possibility, especially because a lot of the families that they serve are working class, so they can't make those hours, they work in the weekends? Is there any way to schedule a vaccination clinic at their church?
There are a couple of possibilities that are now available, so I encourage that church to contact the health department directly and either ask for myself or the assistant director.
Thank you. Have a great day, everybody.
Thanks, Christy.
Thank you, Christy. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. I kind of going further on that, Ms. Wells, we've talked about how we get vaccines into underserved communities. And I guess last time we talked about that, the focus was really on United. But has the health department been hosting events or kind of going to events more often? Or can you just kind of give us an update on how you're reaching those underserved communities?
The 2 ways we're really focusing right now is one is through the Vaccine Ambassador Program, where we have individuals out in the community who are helping enroll high-risk individuals and getting them into the Civic Center Clinic. The Civic Center Clinic is still the most efficient way to get individuals vaccinated. It's where I can vaccinate, 2,000, 3,000 individuals a day. If we start going into smaller groups, I can only vaccinate 10, 20, 30 people in an afternoon. We now have the free city bus service to get into the Civic Center. We will be partnering and working to get some additional staff to go out and reach individuals at home. And once we start slowing down the number of vaccines at the Civic Center Clinic, then we will be focusing on outreach as our immunization program is typically done. We've gone out and given vaccines at the libraries, community centers, and those types of places.
That's great. So the vaccine ambassador program, that's up and running. So can you,
Yes.
how many members there are and what they're doing? Are they going door to door?
Not door to door yet. There's individuals, we're in the process of training people. We've made notifications of everybody that's got chosen through the first round. They will be able to enroll people on site and give them a registration card. I know there's some plans for them to go out and, reaching out to churches to sit there after church services are done. There's some individuals that want to go and sit in the grocery store. So we're kind of letting them innovate and find the best places to reach those individuals who haven't come into the clinic.
Very good. Thank you.
Thank you, Matt. Now we have Olga Guerrero with El Editor.
Buenos dias to everybody. Good to see everybody. Mayor, I guess I would have to start with you, sir. How do you foresee Lubbock in July compared to now? Compared people following recommendations and those that don't care. I mean, how do you see Lubbock in July compared to now?
Well, it's a hypothetical, Olga, so we'll just have to start by that. I think we'll have many more people vaccinated. I think would be my first comment. I think we'll still have a lot of our citizens following the same protocols that they've followed now for a year. But I think life in July will be probably something that we recognize a little bit more than what we've been living for the last 12 months.
Okay. I asked this last time, but I didn't get a number, and I was just thinking maybe, Catherine, what are the testing totals that are being done? And if you could be kind enough to give us that City Bus demand phone number so we can really expose that. I think that's going to be very helpful.
Let me help you with that number. The City Bus there's the on-demand app can be gotten at the Apple Store or the Android Store. Or if you need help, you can call 775-3640. Okay?
Okay.
We'll take care of you.
Okay.
Yesterday we did, you talked about tests. I happened to be looking at those numbers a few minutes ago. We reported north of 400 tests yesterday, just a little bit more than 400 tests. And we had, I think, 13 positives. So the positivity rate was a little bit between 2% and 3% yesterday. Catherine's my memory roughly right on that?
Yes, thank you, Mayor.
Yes, and I think that age group, that 18-25, we just need to encourage them because, I mean, it's kind of risky because like Mayor said, they can be walking around with this virus and they don't even know it. So we need to really encourage parents, relatives of those family age group to encourage them to go get tested. So testing is very, very important, and it's going to continue to be very important. Am I right, Doc?
Yes, ma'am. Absolutely. Always.
Thank you for your time, and God bless you.
Thank you, Olga.
Thank you.
Olga. Now with the Daily Toreador, we have Bao Pham.
Good morning, everyone.
Hey.
All right, so my first question for you is, with the mask mandate removed, do we still have to social distance, and does the removal of masks reduce the effectiveness of social distancing?
Now, remember, even though it's mandated or the mask mandate has been removed, the things that stop the disease spreading is still wearing a mask, social distancing, and washing your hands. There's no mandate now, but common sense would say that you still need to wear a mask so we don't spread the disease, and you still need to be socially distanced so you don't spread the disease. The very same reason you have an air filter in your car is the very reason why we wear a mask. It's to prevent you from getting infected, and the reverse works the other way, from you, if you are infected, giving it to somebody else. So in my eyes, you still need, if you're not vaccinated, you still need to wear a mask. And if you are vaccinated, you should wear a mask to prevent spread to others, because we don't know if you could still, it not affect you, but you could still maybe give it to somebody else. Those studies are not complete yet.
Wonderful. And a follow-up for that. So we all know that spring break is gonna happen soon. And with the current progress with vaccination, is it safe enough for people to gather in groups? And how many people can we gather in order to make sure that the virus don't spread further?
Again, those same recommendations, small groups with people wearing masks are probably okay with social distancing. Outside is better than inside. All those same guidelines still affect. So if you're going to go to the beach and you're going to be outside with your group, your apartment buddies that you live with, or your family that you live with, at the beach, it's probably okay not to wear a mask, but it's got to be outside. You stay in small groups. I'm sure somebody's going to come out with a mask that matches your bathing suit. So.
All right. Okay. My final question. And so since I'm a person from the age group of 18 and 25, we really expect to have ourselves vaccinated soon. And with the details on, on the vaccination process and how the case numbers are in the same age group, we are really worried about that. So is there any sign that we might be able to get the vaccination soon in the future?
Come April 1st, I think we'll open up a little bit more. Really the vaccination process is based on the science of who is most likely. It's a tiered process on who's likely to become the sickest if they get the disease. That's the current thinking about, it's my understanding, how they're tiering the process. So 18 to 24-year-olds is probably still going to be a little while.
Wonderful. Thank you very much. Have a great day, you all.
All right. Wear your mask, Val.
Thank you.
Thank you. Now we have Laura Lawhead with KMAC News. Laura, can you hear us? She's unmuted. We'll come back to you, Laura. Okay, now we have Karen McKay with KCBD. Can you unmute Karen? Karen? Okay, we'll come back to Karen. So let's go to Jamie Lozano with Texas Tech Public Media.
Hey, y'all, can y'all hear me okay?
Yes.
Yeah.
All right, perfect. And so we've already touched a bit on the mask mandate and how businesses can respond, and they do still have that right to require masks. Is there any kind of support that the city is planning on offering those businesses who do want that, but are maybe afraid of how some customers might react?
Well, Jamie, just like we've been doing through the pandemic, if a business owner calls us because someone is not willing to follow their request, we would respond and try to help make peace, so to speak. We're not going to. There's no penalty for not wearing a mask, but if the business owner wants us to help out, we'll do so. Now, that being said, we've had virtually no problems of this type over the last 6 months, 9 months now. Nearly 9 months the mask mandate was in place. So, but if a business needs help, they need to call us. We'll do our best. We will help them. Call the non-emergency phone number at Lubbock PD.
Okay, and my second question is, just kind of in regards to what everybody is asking about the next eligibility group. Does the city have any kind of say or ability to go ahead and start vaccinating the next group now that we have so much of the first 2 tiers vaccinated already?
When I accept the vaccine on behalf of the city from the state, I'm required to follow those state guidelines. And as long as there's individuals who still qualify, we have to work on getting them into the clinic.
That's all I had. Thank you all.
Thanks, Jamie.
Thank you, Jamie. Now we'll go back to Laura Lawhead with KMAC.
Hi, everyone. Can you hear me now?
Gotcha.
Gotta love Wi-Fi issues. Well, now that the mask mandate is being lifted, how concerned are you that our great low daily new cases might go back up again, kind of like we saw in the summer when the state opened up again and we saw a spike in cases?
I'll start and then I'll let Catherine talk about it. I mean, I think I share some concern. However, I think it's very different today than it was then. And that is largely due to the vaccine and the fact that a lot of our citizens are walking around with antibodies because they have successfully recovered from COVID-19. Catherine, what would you add to that?
I mean, as a public health professional, there's always that concern of lifting up anything that's required. I still recommend masks. And like the mayor said, before when we've opened things up, there were absolutely or very few cases. And we weren't anywhere near herd immunity. We had very little immunity in the community. And now we do have some of that. So that immunity will slow down the spread. And if we can get people to continue to wear masks, continue to work on vaccinations, we're going to get through this sooner.
Gotcha. Thank you. And coincidentally, last Wednesday, when the governor made the announcement here in Lubbock, Houston became the first city in the country to report all the variants of COVID-19. So that being said, how concerned are you about variants coming to Lubbock now that they're more present here in Texas?
I mean, I'll start on this and I'll let Ron go. I mean, I don't think most Lubbockites they take care of themselves. They make individual decisions to protect themselves. So sure, the virus is here and it's all the variants of the virus will be in Lubbock. And we know how to protect ourselves. And the good thing we've learned about the vaccine is it appears to be effective or very effective at these different variants. So, I mean, I can't add fuel to this very concerned kind of mindset. We've been doing this for a year. We know what keeps us safe, and we can do that. We have to make good decisions. Ron, I'll let you add the medical, probably a much more balanced medical.
Well, I agree completely with what you said, Mayor Pope. Our vaccines are doing a very good job of covering it. Our vaccines show that even if you were to get infected with most of these variants, that it would not cause severe disease. And that's our biggest concern, is that severe disease usually ends up in the hospital and overwhelming the hospital. So right now, we've not had any reports of any of the variants. Is it here? Common sense would say perhaps we might see some after spring break, a few weeks after spring break. So we'll just have to continue to monitor our numbers and make appropriate changes if we see that happening.
Gotcha. Thanks so much. Have a good one.
Thanks, Jamie. Thanks, Laura, for Jamie.
Okay, next we have Karen McKay with KCBD.
Can you hear me?
Yes, ma'am.
Yes, ma'am.
Can you hear me?
Yes.
All right. Dr. Cook, I was excited to hear that you said the Johnson & Johnson vaccine is here in Lubbock now. I know a lot of people who've said, I'm just going to wait for that Johnson & Johnson vaccine because it's just one dose.
Yeah.
So how can you get that one? Can people make a preference, and where do they go? Where is it available?
According to the state website, Karen, Covenant Hospital looks like they received some doses, and a few other doses kind of scattered around at different places. It's not widely available. And Karen, the most important vaccine is the one that we put in somebody's arm. So it doesn't really matter where you go. The Johnson & Johnson is about 67% effective. The Moderna and the Pfizer are 90 to 95% effective. And so all of them are very effective. So people can find out where they went on the DSHS, State's Department of Health website. So through the allocation website, and find out that way.
So do you expect more of the Johnson & Johnson to come to Lubbock, where that could even be available, say, as a choice at the Civic Center at some point?
Perhaps. We've asked for some, we just haven't received enough. We just haven't received any to disperse to the community. We've not received it. We've received Pfizer and Moderna.
You don't sound real excited about the Johnson & Johnson, are you?
Oh, I am. Please come get it. If we have it, please come get it. Like I said, vaccines don't prevent disease. Vaccinations do. I'm completely fine. Just get a vaccine in your arm.
Karen,
All right.
I think the supply on the J&J, they promised the U.S. 20 million doses by the end of March. They've had some challenges getting that done. I think it's likely to get done, but I don't think we'll see much of that supply till the very, very end of March. So probably 2-3 weeks out.
And they did go to the super hubs first. We're a hub. We're not a super vaccination site. So that's why we didn't get some of the big doses.
But we may later.
Mm-hmm. I believe we'll continue to get it.
Thank you.
You bet.
Thanks, Karen.
Thank you, Karen. This concludes our news conference for today. Thank you for joining us, and thank you as always to our panelists. We hope you have a safe and wonderful week, and we'll see you next time.